Here's a startling truth that's been buried under waves of misinformation. Vaccines do not cause autism, yet this myth persists, fueled by fear and flawed science. Despite overwhelming evidence, the debate rages on, leaving parents confused and children at risk. But here's where it gets controversial. Even reputable institutions like the U.S. Centers for Disease Control and Prevention, CDC, have recently revised their language, subtly undermining their long-standing, science-backed stance. So, what's really going on? Let's break it down. For years, extensive research has consistently shown no causal link between vaccines and autism or other neurodevelopmentally disorders. Yet, figures like Robert F. Kennedy Jr., a prominent health advocate, have perpetuated anti-vaccine rhetoric, connecting the two without scientific basis. This isn't just a minor disagreement, it's a battle between evidence and misinformation, with real-world consequences. WHO Director General Tedros Adhanom Ghebreyesus addressed this head-on at a Geneva press conference, reaffirming that autism is not a side effect of vaccines. The Global Advisory Committee on Vaccine Safety conducted a thorough analysis of 31 studies across 15 years, focusing on vaccines containing thiomersal, a preservative, and aluminium adjuvants. Their conclusion? No link between vaccines and autism. This isn't the first time such a review has been done. Similar studies in 2002, 2004, and 2012 reached the same result. Yet, the myth endures. And this is the part most people miss. The entire controversy traces back to a flawed 1998 study that falsely linked the measles, mumps, and rubella, MMR, vaccine to autism. The study was later retracted for using falsified data, and its findings have been debunked by countless subsequent studies. But the damage was done. The idea took root, and even today, it influences public opinion. Kennedy's claims, though dubious, have gained traction among followers of his Make America Healthy Again movement, tied to President Donald Trump's broader agenda. Meanwhile, scientists and public health experts, including those within the CDC, are alarmed by the agency's recent website edits, which they fear could sow further doubt about vaccine safety. Here's the bigger picture. Vaccines are one of humanity's greatest achievements. Over the past 25 years, under-5 mortality has dropped by more than half, from 11 million to 4.8 million deaths annually, largely thanks to vaccination. Vaccines protect against nearly 30 diseases, from measles to cervical cancer to malaria. They save lives. But the question remains, why does the myth persist? Is it a failure of communication, a lack of trust in institutions, or something deeper? What do you think? Does the anti-vaccine movement deserve a platform, or should we double down on science-based messaging? Let's start a conversation, because in this debate, the stakes couldn't be higher.